You're listening to Fast Facts, Ask the Expert with Katrina Sanders.
Hey everyone, welcome back to Ask the Expert, our monthly podcast answering the clinical questions that keep dental hygienists on their toes. This month's big question: when should we reevaluate a periodontal case? Is it 3 weeks, 6 weeks, 3 months? Well, let's take a look at what the science says. When we're managing gingivitis, remember, our primary goal is inflammation resolution. However, when we're managing periodontitis, the goal shifts. We still want to eliminate inflammation, yes, but we're also looking for tissue repair, ideally with new attachment via the long junctional epithelium. That added clinical goal means healing can take longer, and subsequently, reevaluation timing becomes a bigger conversation. So let's dive into gingivitis. For gingivitis, tissue inflammation typically resolves quite quickly after debridement. Clinical guidelines support a reeval within about 2 to 4 weeks following our treatment. That's when we can expect pink, firm tissue and a reduction in bleeding tendency in otherwise healthy patients. In early to moderate periodontitis cases, or stages 1 and 2 periodontitis, we still see some tissue response within the first 3 to 6 weeks, but that depends on factors like periodontal probing depth, the patient home care, and other patient-specific risk factors. Now, here's where things get interesting. For more advanced perio cases, some clinicians recommend waiting a full 3 months before reevaluation. Why? Because research shows that the majority of clinical and microbiological improvements, like probing depth reductions, pocket closure, and attachment gains, will stabilize around 8 to 12 weeks post-periodontal therapy. In fact, classic histological studies tell us that the long junctional epithelium, our key player in non-surgical attachment healing, typically forms by 60 days post-intervention. At that point, it resists further inflammation and helps to maintain stability. So, pushing that reeval to the 10 to 12 week mark for more complex cases may allow us to truly assess the full regenerative outcome. So, what's the clinical takeaway? For gingivitis cases, consider reevaluation of inflammation resolve anywhere between 2 to 4 weeks following your gingivitis therapy. Here, we're checking for tissue tone, color, absence of bleeding, and ultimately, patient compliance. For stage 1 and stage 2 periodontitis cases, consider scheduling the periodontal reevaluation around 4 to 6 weeks following your implementation. Here, we are assessing for healing, and we are also hoping for a resolve in the inflammation and clinical attachment. At this time, we are also evaluating patient compliance to their home care and considering whether further therapy might be needed. Finally, for advanced periodontitis cases or systemic cases in which we anticipate an immunocompromised status or delayed wound healing, consider scheduling that reeval at the 10 to 12 week mark post-therapy. This, in most scenarios, allows for full tissue maturation and long-term healing assessment. Remember, reevaluation isn't just a formality. It is a diagnostic checkpoint that tells us if our initial treatment plan was successful or if we need to shift course. And if we delay too long, we risk missing those earlier signs of disease recurrence. So that's your evidence-based look at Perio reevaluation timelines. Thank you so much for joining me, and until next time, keep fighting the good fight for your patient's health. Please feel free to reach me on Instagram at The Dental Wine Hygienist or on my website, www.katrinasanders.com. Cheers.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew at ataleoftoahygienist.com, and we will get it on the air as soon as possible. Thanks for listening.